Good afternoon, and welcome to a webinar on an exciting new product for positional sleep apnea called Night Shift. Night Shift was developed by Advanced Brain Monitoring and is the next product in our many categories of new innovations for the sleep medicine field. The Night Shift is worn around the neck, and the indication for use is by prescription for the treatment of patients who have positional sleep apnea with a non-supine apnea-hypopnea index of less than or equal to 20. Night Shift is also cleared to reduce or alleviate snoring. It also has the capability of recording position, movement, and sound so that the impact of positional therapy and snoring can be assessed. So to begin with, what we'd like to do is show you some data from a study that was recently published in the Journal of Clinical Sleep Medicine that points to the prevalence of positional sleep apnea. And you can see here that looking across severities of very mild, moderate, and severe sleep apnea, approximately 70 to 75% of all patients who were studied during polysomnography have positional sleep apnea. Positional sleep apnea means that the amount of severity when they're sleeping on their back is 2 or more times greater than the non-supine apnea-hypopnea index. Now, one of the things that we notice, because Night Shift is cleared for patients with positional sleep apnea who have a non-supine apnea-hypopnea index less than 20, you can see that clearly for all of those with positional sleep apnea in the very mild and mild categories, which constitute around 75% of all people in those categories, Night Shift would be appropriate for. For those classified with overall having moderate sleep apnea, this product would be beneficial to about 66% of all the patients. And for those with severe sleep apnea, approximately 35% of those also have a non-supine AHI less than 20 and may be appropriate for Night Shift. What's novel about the Night Shift? Well, first of all, unlike many of the other positional therapies dating all the way back to the sewing tennis balls in the back of pajamas, this device is comfortable. As we said, it simply is worn around the neck, has 2 little magnets that clasp in the front. So the advantage here is that we're moving patients off their back without making it difficult for them to sleep. It's also adaptive, where most of the pillow type approaches are temporal in that it's either on or off. With Night Shift, what happens is when you move to your back, it recognizes the back sleeping position and slowly begins to vibrate, much like your cell phone. And it slowly increases in intensity if you don't respond to the initial low level. So the concept is we want to not startle the person awake, but gently move them off of the supine position, much like a bed partner might with a softer elbow. The one advantage about Night Shift over any of the other positional therapies out there is we're also able to monitor the position. How much time are you spending on your back? Sleep quality, looking at sleep and wake and awakenings. And we're also able to measure snoring with an acoustic microphone. So we're able to obtain compliance information similar to what you get for a CPAP machine, so that this can now be an alternative therapy that can give 365 days worth of information on did the patient use it and was it effective. I mentioned earlier that it has report capability, so the device stores all of the information. You can plug it into the computer, and with internet access, you can get free detailed reports that provide very, very useful information to both the clinician or to the patient on how they're doing. So some of the highlights is we can count the number of times that the patient attempted to go sleep on their back and how quickly they responded to feedback. There's benefits like being able to measure, as I said, sleep efficiency. So you're able to look at when they're awake, which happens to be a darker gray stripe, and how much wake after sleep onset, number of awakenings per hour. The device has the capability of also be used as a monitor, so you can turn off the feedback, so you could attain a baseline from somebody to look to see how much time are they actually sleeping in home on their back without having the influence of therapy. And you could also then look at what is their snoring level in the supine position and what is their snoring in the non-supine position. The snoring that we measure is based on loud snoring, so at least having one loud snore that's greater than 50 decibels in a 30-second epoch is how we're computing this loud snoring category. So here's an example. On the top is a report where the gray areas are the patients sleeping in the supine position, but it does not have feedback. And down below, when they're sleeping in the supine position, it's marked in red, and you can see here that the patient responded very, very quickly to therapy. Another advantage of night shift is that it can be set to trial mode. And in trial mode, you can send it home with the patient, and the first night it records information on snoring and sleep quality and percent time supine, and automatically on night 2 it begins to develop feedback. So it allows the patient to be able to, or the clinician, to be able to see how's the patient doing and do they like the therapy. Now, if you put night shift on, and there are different clinicians, I know ApneaLink is a very, very popular product, but because it doesn't measure sleep and wake, and because it doesn't measure snoring, and because it doesn't measure position, you could combine night shift's report with either oximetry or a ResMed ApneaLink and at least be able to get a qualitative assessment. You would not be able to exactly align the data, but you could see whether or not the events that are occurring across different positions or are predominantly clustered around a supine or a non-supine position. Now, I mentioned earlier that how we measure the percent time snoring, and in a paper that we published, we looked at the percent time snoring where it exceeds 10% of the night, and we were able to identify that there is a strong correlation between percent time snoring above 50 dB and an apnea-hypopnea index. So you can see here that you could use night shift as a screening tool, where here we're looking at the sensitivity and specificity overall, supine and non-supine, where it actually both the sensitivity and the specificity with an AHI of 10 is quite good in the non-supine position, isn't quite as good in the supine position, and partly that is because the acoustic microphone is somewhat muffled underneath the pillow. In the chart below, what we see is now we're comparing the percent time snoring to a home sleep test. The upper one was to polysomnography, and now you see that when therapy is delivered, both the sensitivity and the specificity with an Aries home sleep test is really quite strong. We also have the capability of being able to look at information. Those detailed reports I showed you, it saves up to 6 nights of the detailed reports, and then the data rolls to a report where you can get information from each night across several months. So here you're able to see how many hours that they wore the device each night. Here is what their sleep efficiency is. This is their sleep quality. This is the percent time on their back. Here is the sleep efficiency. Here's their number of awakenings per hour, so you can look at their sleep fragmentation. And here's their percent time snoring over the course of a night. So in our study, the study again now published in the Journal of Clinical Sleep Medicine, this provides information that shows validation, if you would. So these are just some of the metrics. The study is downloadable from the Journal of Clinical Sleep Medicine website, but you can see very, very strong significant values for changes in time supine, overall and supine AHI, apnea events per hour, time below 90% SpO2, and percent time snoring below or greater than 50 dB. So you can see that clearly this product for patients with positional sleep apnea does a wonderful job in getting and keeping them off their back. And as a result, it contributes to a significant reduction in sleep disorder breathing and snoring. And it also does a very, very admirable job in improving sleep architecture and sleep continuity, where you're seeing significant reductions in both arousals and awakenings, reductions in stage 1 sleep, and improvements in stage 2 and REM sleep, and close to significant results for sleep efficiency. So the bottom line is, when patients wear this device, it substantially improves how deeply they sleep, and the number of times that they may be challenged to move off of their back is substantially less than the number of times that they would otherwise have sleep disorder breathing events that would be interrupting their sleep. So that concludes the webinar, and I hope this answers most of the questions that you have, and feel free to contact us directly if you have more questions.